Expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning.
Good morning. We have a spy in our
we have a special guest
in our studio.
Yeah. Well, we've been talking about Dr. Gonzalez now for a while. So finally we get to have him in person. Welcome. Good morning, Dr. Gonzalez.
Good morning, and thank you for the invitation.
Oh, so happy to have you here. And we've been working together now. And,
it's a missing piece that you've had,
isn't it? It's the missing piece that we had. And, it's like it was a godsend to the practice. Dr. Gonzalez, tell us a little bit about the different specialty, different board certification that you have, so people get to know who are you.
Thank you, Andy. So my name is Manny Gonzalez. I'm originally from Cuba. I came to this country, wonderful country, 20 years ago. Then in Cuba was a cardiologist, finishing training, one of the most prominent hospitals in Cuba. Then got to the U.S., didn't speak any English whatsoever. So my first few years was
like most
learning.
Cuban when they come here, right?
Yes, I speak a little bit of Russian at that time, but learning English and a little bit of time in Miami for a year and a half or so at University of Miami, learned some English, and then I started passing my boards, got accepted to do a residency at Harvard University, one of the primary care programs, did internal medicine there. From there, I went for a cardiology training in North Carolina, the Eastern North Carolina Heart and Vascular Institute, very busy place in North Carolina in terms of heart attack and stroke care. Well known as the stroke belt of the country. So we are there and we train in cardiology, and then obviously I want to be doing more for our patients who unfortunately suffer from this terrible disease of atherosclerosis. So I want to do more like interventional work. Mm-hmm. And I was accepted in Washington, D.C. One of the most prominent international well-known programs is the Washington Hospital Center for Interventional Cardiology Program. That's to open blocked arteries, take care of patients with heart attack, stroke, etc. And then there I also did a vascular medicine training. Then I, summarizing all of that, I have a board certification in internal medicine and train at Harvard. Then training general cardiology at Eastern North Carolina Heart and Vascular Institute, board certification in interventional cardiology from Washington Hospital Center, Georgetown University, and then endovascular board certification. So that's pretty much it.
Okay, but wait, I got to jump in here. I always, and it's not about sex, don't worry. With all those great credentials, do you have bedside manner?
That's fundamental. Without that, you cannot go anywhere.
That I can abide to, and my patient will tell you he has excellent bedside manner.
It seems like the foreigners originally have the bedside manner. Is it something you learn in your country that the Americans don't learn?
No, I think we don't, in school, we don't teach the new doctor about the business of medicine. We don't teach about bedside manners. And I remember going to medical school. My first semester was taught by nurses, and it was basically to teach you good bedside manners. And to the second objective was that you need to learn to respect and appreciate nurses, because doctor without nurses is like a gun without bullet. It's not going to work. Right. So we learn to appreciate and work with nurses, and you learn to have good bedside manners. But I think bedside manners, because I work with many different cultures, is instilled in you through your parents. Your parents give you moral value and give you certain parameter to follow in society, and once you are armed with that, then there are many doctors out there that they are excellent. I mean, we just heard the credential of Dr. Gonzalez.
But Dr. Mencia,
he
you
could
do
be
know
one of those doctors that could
exactly.
be in his big white horse that we had to really bring him down to look at us, and he's as humble as they come.
But because
So-
I've heard people say, "Oh, I've got this great doctor. You know, he's not great. I mean, he doesn't really seem to listen to me, but I know his credentials are great." Well, I don't want to go to a doctor like that.
Exactly.
That's fundamental.
So you had nice parents,
Absolutely. So
because it does come from them, doesn't
yeah,
it?
absolutely.
And so, why did you choose that field of heart and vascular?
Well, that's a family story. Growing up with a grandmother that suffered from Prince metal angina, which is the spasm in the arteries in the heart, and having recurring chest discomfort. So my grandma was pretty much every single week admitted to the hospital with terrible chest pain. Mm-hmm. So we had to be rushing her to the hospital and admitting her and doing this again and again, pretty much every week as a young boy, and seeing her getting cardiograms and going to the hospital and suffering from this disabling chest pain that they were always looking at the cardiogram and say, "Oh, she's having a heart attack." And no, it's not a really heart attack. It's a spasm because after a couple of medications resolved the angina. So I grew up like that, and I said, I really want to help patients who are suffering from heart conditions.
To our advantage, to our country advantage, our community. Dr. Gonzalez was a cardiologist in his country. He came back, he started all over again, and he became a cardiologist. So he is a cardiologist twice in his life.
That has
so
to
it's
that
fascinating.
happens, doesn't it?
It is
Sometimes?
fascinating, absolutely.
And Dr. Mencia, you have said so many times on your program that people come in thinking they have one thing, and it's really something else. You've often said that you always go to the heart and see, because you've always taught us about the heart. Of course, now we're featuring your book on the kidneys in our June issue. But the heart seems, just like he was talking about the brain in our last interview, but the heart is where everything is just flowing from.
Well, it's the pump. It's that pump that we need. Just like if you have a beautiful garden, either you're going to have to hand water the whole all the corners of the garden, or do you have a system that will irrigate through a pump and get the water there? So the heart is that pump that irrigates the entire body. So the universal maintenance of our human body comes from the heart. And that's why we say we love with the heart.
Yeah, we love with the heart. Well, I want you to ask you something, Dr. Gonzalez, because it seems that many older people, when they wind up in a nursing home or they wind up and they die, they die of congestive heart failure. Now, talk to us about congestive heart failure. Is that just something that the doctors just say that's what it was, or is it really something else?
Right. So congestive heart failure really had exploded our understanding of heart failure in the last 10, 15 years. We know for many years back, 20 years ago, when Dr. Manuel described the new understanding of the physiopathology of heart failure and multiple different mechanisms. But really in the last few years, we have understood better about heart failure. And the heart failure, the fail of the heart or the cardiovascular system, come from different aspects. It's both a failure of the capacity of the pump to squeeze and pump blood out, but also a failure of the pump to relax and accept the blood that comes to the pump. So it's both the squeeze and the relaxation of the heart. And you can name every single condition or systemic diseases that in one way or the other can affect the heart, either their squeezing function or the relaxation function. As such, the most prominent that I can say is the lack of blood flow in the heart, or blockages in the arteries in the heart can damage both the capacity of the muscle to receive oxygen and to squeeze, but also when the scar develops, the capacity to relax and fill with blood. So a tender heart, a very stiff heart is not a good thing. So now we learn the importance of appropriate controlling of blood pressure to prevent the heart from stiffening and let the heart relax better, diabetes, many other conditions that can affect both the squeeze and the relaxation of the heart. So pretty much nowadays we look at heart failure as a big picture, and there are many diseases that can affect that, and it's our job to sort them out and figure it out how can we better help these patients.
You know,
And also alcohol, how alcohol can affect
Absolutely.
the heart, and then it become
Weak and later.
that elastic band becomes so relaxed that the heart start enlarging. And you see those people when they get an X-ray, the heart almost take the entire chest wall. So I mean, the heart cannot squeeze any longer. Yes.
and so, and I guess my next question is because of longevity of people. At what point would you perform these procedures on someone if they're 90? Let's say they're a healthy person, but they have heart problems, and
Right.
I mean, how could it be 95? I mean, is there an age where you wouldn't do something?
Well, age is defined very different nowadays. Our elderly patient, now they are looking younger and younger. My patients, and sometimes for me it's really hard. I have a 90-year-old in front of me. I go, is he 70 or he's 65?
I love that.
I mean, they look so vibrant, so
Yeah.
young. I remember 25 years ago when I graduated and I started, he said, well, you have this elderly 75-year-old person. They look frail and cachectic. But nowadays, we're talking about a 90-year-old person. It looks so vibrant. Say, well, I just did 2 miles before coming here. They look great. So age is defined in very different ways nowadays. So many heart and cardiovascular doctors look at the patient. I'm a geriatrician, cardiovascular specialist, because 99.9% of my patients are over 70 years old. Very few are in their late 50s, 60s, but the vast majority are 80s, 90s. And that's how I spend my time. That's why my partnership with Dr. Mencia is so phenomenal.
It is.
Because we together can bring a really comprehensive team to these patients that not only suffer from the heart condition, but also all the vascular problems. And when the patient needs a procedure, our procedures, and thanks goodness to the technology, is done with, first of all, no general anesthesia. It's just a mild sedation.
They
It's
don't even
even
have
less.
to go to the hospital.
Some of them, no. Everything's done outpatient. We combine on the heart and vascular centers in South Florida. We have 3 and soon to open the 4th center. Where
are they? Excuse me.
Well, we have one in Key West, Homestead, Miami, one here in Fort Lauderdale in Commercial Boulevard with
One
Dr. Mencia,
coming up
and we
in
are
Boynton.
opening one in Boynton Beach. And these procedures are done when needed, are done with a mild sedation, even less of what you get for colonoscopy. Actually, many of my patients don't even want anything. They get a little bit of a Valium, something to relax, and they don't get anything.
But tell me what this procedure is. Give me an example.
Well, for example, we do cardiac catheterizations, and when we need the patient, we suspect that might have blockages in the heart, and we want to be 100% sure, we go with a very tiny catheter, less than a millimeter, like an IV that they put in the hospital to draw blood or to give you IV fluid. We come here from the wrist, or sometimes here from the elbow. They put an IV, and through that, but not in the vein, but in the artery, we call it the radial artery or the brachial artery. We put a little IV, and then through there, we come to the heart with a 1 or 2 millimeters in diameter catheter, and then we inject a little bit of dye right there directly in the artery, and we can see the flow directly there to the muscle. And then we don't get, we many times have patients who have blockages in their kidney arteries and causing very high blood pressures, and we can go there and we can selectively take a picture, and if we confirm the blockage, then we can easily open the blockage with a little tiny balloon, and then we put a stent, one of those meshes, or we also call them a spring that keep the artery open. These new stents are impregnated with medication that keep the artery open and prevent it from blocking them up.
Prevent clots from
This is
forming.
fantastic.
We go down, and many of our patients have blockages in their arteries, and they hurt, they cannot walk, they're losing their functionality because they have a lot of crampy pain in their calves and leg, and they cannot walk. Has been blocked up because of smoking, because of diabetes, because of old age, because of genetics. So the same way that the arteries in the heart blocked up and cause a heart attack, well, in the leg happen the same. They blocked up, there's no blood flow to the muscle of the leg, and then they can develop first pain and what we call claudication, or incapacity to walk. And many times that progress to the point where they form ulcers and gangrene can happen, and the patients sometimes with diabetes and poor circulation can have require an amputation. So our goal is to prevent. We say we have a maximum that say save a limb, save a life, because we know that
Save a limb, save a life.
yes, if we prevent that limb from being amputated, we save a life.
Yeah.
Once a patient loses a leg because of an amputation, because of a gangrene, then that patient loses their functionality, their freedom. They require 24/7 care. They need to be admitted to nursing home. Their quality of life decline. And we know they have more than 20% chances of dying in the next year or two. So keeping those circulation arteries open is predominant.
And I had, just to bring it to life, we had a case that the patient underwent knee replacement. And what they wanted to do, they say, well, I'm still having pain, and I want to know if the knee replacement was done wrong. Now, I'm not an orthoped. I don't do orthopedic. I don't do knee replacement, but I can, I'm a doctor. I can look. I say, let me look at your x-ray before the knee replacement. And definitely there was a lot of arthritis, a lot of pain. So maybe the knee needed to be replaced. But I say, why am I still having pain? Was the prosthesis put there wrong? And the x-ray looked fine, the alignment is perfect. I said, let me check your vascular situation. So when we look at the vascular, right behind the knee, the blood vessel was basically closed. And I said, no, we need to see a vascular surgeon. So we sent the patient to Dr. Gonzalez. Patient go in, he got a stent put in, and the pain went away. Not only that, then he stopped using his cane. Now he can walk normal. People don't know, why are you using a cane? I have a knee replacement. Now he just walk like a normal person. So it's that quality of life. A lot of people, they think, the walker is a solution. The cane, and God forbid, the wheelchair is a solution. And that is your death sentence. Because if you have vascular condition and you sit in a wheelchair, it's like if you have the same condition, you say, now I'm just going to sit on the recliner. I'm going to become a couch potato, which means things are going to get worse, no better. So with the procedure that we are able to do through Dr. Gonzalez, through his expertise, patients are able to go home, the same day. And the beauty is, and the guy is so humble, he won't say, but I will say it for him. He had gone to patients' home just to make sure that things, just the other day, I have a case that I think I was telling you about, the case that was assigned to me by the judge. And the patient is in a nursing home, and the judge said, Dr. Messi, I want you to be the primary care. I said, I don't do nursing home. I said, well, I want you to do it for me on this case. So I'm going to a nursing home where I have 2 patients there, one assigned by the judge. And I asked Dr. Gonzalez, I have this case. He went from my office straight to the nursing home. I say, I'm at the nursing home, I'm seeing the patient. It's so wonderful to have somebody with his calibers, his level of training, the community. As a member of this community, I'm so proud to partner with him.
Well, Dr. Mencia, that's, I think, the reason why when people have heard you on the radio all these years now, they catch that. They get that. And there's so many doctors who could be very good doctors, but at 5 o'clock or at 4 o'clock, the office phone's turned down, and it's over. Yeah. And that's why you're having the Saturday hours that you do, or now that you go and you do home visits. It shows that you really take your profession, it's not just a profession anymore, it's your whole being. And when you say that Dr. Gonzalez the way you do, then I accept him in because I trust you so much, and our listeners are going to feel the same way.
Absolutely.
Because,
absolutely.
It's rare to find this.
Well, it's absolutely right, but that's what makes us so competitive in this marketplace, and also will make us so effective to meet the needs of the patient. For example, yesterday we did in Miami, we did approximately 10 vascular surgeries in my center in Miami.
10?
About 10.
In one day?
Yeah, those were venous, which is relatively quicker. Venous ablation for patients with ulcer and venostasis and congestion and very swelled leg. So we did 10 of them, and then by about 4:30, I got a call from one of the prominent nursing home places in Miami, it's the Palace. and they have several of them from Miami too. So they are wonderful people, and they call me and they say, the nurse, the chief nurse, who calling me, please, I'm begging you, we have a VIP person here who really needs your help. Can you please come? It's 5:30. My kids are at home. Haven't seen them in a couple of days for some emergencies. And I say, oh my gosh. But, I have to do it. So I pick up my car. Actually, my car was in the dealership, so I pick up my ambulance. And I jump in the ambulance and I go over there with the traffic. And then the nurse is telling me, the wife is here. She really want to see you. This family has been struggling for years. This gentleman has dementia, frontal dementia by MRI 3 years ago, but they put a pacemaker. Now they cannot do MRI. He's progressively getting weaker in the left side. He has a very swell leg. We had done an ultrasound. There is no clot in the left leg. We want to get an opinion from you what this is. And sure enough, I just got there. I have my impression that this is not vascular, but I sit down with the wife and the patient, and we had a wonderful afternoon, an hour and a half, sitting down and just talking and listening to them. And she told me all the struggle that she has in her life with her husband, a veteran who served very proudly this country in Vietnam, got injured in the spine, and from that point on, he had been suffering and suffering. This time what I learned is that after 3-4 neurosurgeons giving opinion, all of them different opinions, she's all lost now. Doesn't know what to do with a person. Apparently he has some hydrocephalus, weakness in the left side, incontinence in the urine, and no moving the left side, so that's why he's getting so swell in his leg. But very clever, the wife described to me, look at his left arm, how it's getting swell and worse than the right. So immediately this shift my attention from a vascular problem to more like inactivity and paralysis in the hemiplegia in the left side, and understanding that this is not a vascular, but what she really needs is someone who sit down with her and listen
and put the case together.
And put the case together and review all the charts and tons of ultrasound done. And this is not about a clot. This is about it. And then kind of redirect her, and she was extremely happy to get someone to sit down with her. But like you said, quadruple board certified interventional vascular cardiologist at 5:30 on a week, on a Friday evening, sitting down with you for an hour and a half talking. And I knew that this was not but it was about a family who need to sit down with someone to listen and to be able to put everything together and get some compassion.
Do you know what we call
priceless.
this? We call this the golden rule.
Absolutely.
If all the religions would come together with the golden rule, we wouldn't have all this fighting, we wouldn't have all this stuff, but you knew that it could have been your parents at some point. That's why you do what you do, and that's why I do. Yeah, because but for the grace of God go I. I mean, this was a wonderful thing you did, and your children, even though they wanted you, they'll remember that.
No, but I got home eventually about 8 p.m.
But
so
you told
actually,
them the story.
when I got home with the ambulance, the kids were excited. When I get in the ambulance, jump in the ambulance.
You should have taken them out to the movies in the ambulance.
That's what we did. We drove around the neighborhood in the ambulance, and they were excited. And then we showered them, we put them to bed.
How old are your children?
Oh, we have 3. We have a 6-month, 1.5, and a 3.5 boy. So they were excited.
What does your wife do for fun?
Oh, well, for fun we do
she's
something.
A good mom.
But she's a good mom.
Gosh,
she's also lovely. Very busy. She's a Harvard lawyer. We both
for
went to
heaven's
Harvard.
sakes, this is fantastic.
And she's phenomenal. She's an amazing
Oh,
person.
another love story. I love love stories. Well, Dr. Mencia, I can understand now why you're so thrilled. You've been telling me about Dr. Gonzalez for a long time, and he actually tried to get an extra half an hour this morning. Of course, we had Gorilla already, because he said, he's going to be so good. But we'll do that. We'll have more time but there'll be a lot of things. But I just have to tell everybody, because we have to get your information down. So if you want to either meet Dr. Gonzalez, go to Dr. Mencia. Oh boy, we have the real stars here. The phone number is 954-489-1345. That's the phone number to call. They are open today on Saturday. Also, let me give you the number again. It's 954-489-1345. It's called the Adult and Geriatric Medical Center. And, of course, they're over there on Commercial Boulevard. And something I have to tell you, if you go to Boomer Times Presents, you will see Dr. Mencia in a lot of the YouTubes with a lot of the things that he's been saying. And I'm now going to put Dr. Gonzalez on YouTube. We'll take your interview. And that's why I have to get your picture here. You have to let me give it a smile.
And what's important also for the audience to understand is that the procedure that we do, first of all, is non-invasive. So when they come to the center, they get what we call an ultrasound. And an ultrasound is non-invasive. So with the ultrasound, we are able to look above the arterial circulation and the venous circulation of the patient. And then because we want to be very preventive in our care, when we look at the circulation, like the other day we had a patient that had an ulcer that couldn't heal. And so we did the study, and we noticed that it was problem with circulation. That's why the ulcer was not healing. You can put all the medication you want in a wound, but if there is no blood flow, that medication is just going to stay there put. So we need blood to flow so that the immune system and the body can fight the infection and heal your skin again. So we will do an ultrasound. Dr. Gonzalez will take the patient, will do his procedure, open the circulation, and as soon as you see the blood flow, you see that ulcer healing back to normal. The person go back to their normal process of healing. So what we do by that, a lot of people that have ulcer have wounds. Those wounds, when they hit the bones, it become osteomyelitis, which is now infection of the bone, and a lot of times they end up with amputation. A lot of people, they have this plaques, and those plaques will travel to your toes, and the toes will turn black, which we call gangrene, and they will have to have toes amputated, especially diabetic patients. So if you have diabetes, whether well controlled or not, get your circulation checked, and have Dr. Gonzalez do an assessment, because a lot of time when we are proactive, you do your part in controlling your diabetes, we do our part in saving your limbs. And the same thing with the veins. People have problem with their vein. We all have a little bit of venous insufficiency.
He already looked at my veins when he knew.
Thank you.
He already asked me. He already asked me about my veins. I have some little spider veins. He says, one or a little two, we better have Dr. Gonzalez. Like, he's a crazy man. That's what he does. Well, because he wants you, it's called prevention.
Prevention,
Let's not
absolutely.
wait, right?
Prevention.
So, well, this has been extraordinary. I hope it's the beginning. I hope. Are you a virgin on the radio show this morning? You done a lot of this?
I have done a couple of them before, yes.
Oh, yeah, that's it. Not this good.
Not that good. Not this good. Not this good.
We love virgins on our show, don't we, Dr. Menzel?
Yes.
He has brought so many people here.
In.
Yeah, we break them in right here on the show. Thank you very much, Dr. Gonzalez.
Great
we
pleasure.
Look forward to
Thank
this.
You to all
Thank
of you.
you, Dr. Mencia. And we'll see you next week. And we'll be right back. We have something really exciting. It's called the Time Machine. You're going to get to be even more beautiful. We'll be right back. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.